Morning, welcome to Kinetic Konnections. My name is Lynne Golden. I'm a pediatric OT, background in anything ranging from the newborn intensive care unit in an inpatient setting to pediatrics, all the way up through teenagers in an outpatient setting. I've worked with kids with sensory processing issues and every syndrome under the sun, cerebral palsy, Down syndrome, pretty much anything you can think of that would impact a child's development. So I'm happy to see you all here. And this is Leslie Tang.
Hi, I'm Leslie. I'm a pediatric physical therapist. I have a background working with patients in inpatient and outpatient settings, inpatient rehab, early intervention, school settings, all the way from birth to age 22.
Great, so we're excited to have you here for our Rebuilding Regulation from the Inside Out workshop, and we'd like to ask all of you to introduce yourselves, share just your background, what you do, and if you could give us one strategy that you like to use in your practice to help with regulation. We'll be making a list over here of your ideas. So we are going to be talking about lots of different things today that impact regulation, and one of the main ideas that we're going to be talking about is pressures, and we're going to be talking about factors from birth and pregnancy that might impact kids and their regulation, and the impact of pressures on regulation also and development. So ultimately, we're going to be looking at regulation through a different set of lenses than the way many of us were taught and the way many of us practice currently with our kids that have issues with regulation. And hopefully by the end of today, you guys will have a good idea of some strategies that you can be using that are very complementary to the things that you're doing already. So we're used to working with regulation from the outside in. These are some of the strategies that we've come up with as a group, and as the title of our workshop suggests, we're going to look at regulation from the inside out. And so I'm going to move forward. Right now it's October, and it's a little bit of a gloomy day today. It's not quite winter. You might be wondering why we have a snowman here on the board. But as we progress through the next hour or so, we hope that you'll see this image through a different set of lenses and how it relates to our discussion on pressures. So with that, I'd like to have Leslie come up and talk about the physics of pressures and how that impacts regulation.
Okay, so pressure. What does pressure have to do with regulation? Well, I'm going to start by showing you what the snowman here is all about. Okay, so the snowman in our discussion today is representing the core of the body. So from here to here, we have cavities that make up the core of the body and that contain all our important organs and blood vessels and nerves. And the first one is the head. The next one is our thoracic cavity, and the lowest one down here is the abdominal cavity. So what we're going to be talking about today is pressure regulation within these different cavities and how the pressures within the three cavities relate to each other and are organized. So the fundamental concept that we're talking about today is, in order to have a regulated pressure, like atmospheric pressure or pressure inside a room or a cavity, the first thing that you need is this, a boundary. You need a boundary that contains the pressures. So, for instance, if I do this, and I put lots of unpredictable holes in this boundary, what is going to happen to the pressure that's inside? The pressure is going to go down, obviously. So we need to have a stable boundary. Is the first thing that we need in order to regulate pressure. So what we're going to talk about next is, what are these? What are these boundaries in our snowman here? What makes up the boundaries of these cavities in our body? So I will start us off here. This one, the abdominal cavity, one of the things that it's made out of is a lot of abdominal musculature, right? Erectus abdominis, transversus, internal and external obliques, these things are making up the boundaries of this bubble or cavity here. And there are lots of other things. So what are they? Let's start sharing together and coming up with and thinking about what these boundaries are made out of.
So what about pelvic floor?
Absolutely. So pelvic floor, right here, very important part of the boundary.
What about diaphragm?
Awesome. Diaphragm is really important in our work, and it's a very interesting one because it's a boundary for this one, the abdominal cavity, and this one, thoracic.
What about the spine?
Spine. Well, the spine, I guess it does make some of the boundary up. That's true. Spine.
What about the ribs?
And the ribs. Yep. So we've got spine and ribs. It's awesome. I haven't really thought about those, but bony structures do make up boundaries. I'm going to throw another one out here. What's up here? It's an area of the body we call the thoracic inlet. So this opening here between the head and the thoracic cavity that's made out of a lot of different muscles, and there are lots of blood vessels and nerves passing through it. Any other thoughts?
So is the skull one too?
Yeah, the skull. And then what? There are some openings in the skull. What are those, some of those openings? Because it's important to think about openings that might be in our
Sinuses?
awesome sinuses. And what about,
Maybe soft spot.
yep, soft spot. And then there's some other muscles in this one. Because we have bones, we have muscles, intercostals. Awesome. Okay. So those are a lot of the pieces, and the thing that's really key to think about, especially with there being some holes like the sinuses and things like the diaphragm and the pelvic floor, which are flexible and made out of muscle, and we can make changes in these boundaries and adapt the boundaries to help regulate the pressure inside. So this is what we're going to be thinking about today as we talk about pressure regulation. Okay, so we've introduced the idea of pressure regulation in the body being a foundation for self-regulation overall in our kids and in grown-ups too. So now that we've talked about the different major cavities in the core of the body and their boundaries, we can go back and look at the strategies that you guys shared in the beginning as being the ones that are your favorites, the ones that work really well for you and your clients. And we can begin to see how they relate to these boundaries and these cavities in the body and the pressure regulation within them. So take chewing gum. chewing gum relates to this first cavity in the head and the skull, and chewing helps regulate and increase pressure in this cavity here. Weighted vests help give extra pressure and support to this cavity here. Bouncing, like bouncing on a ball, helps to increase pressure in both of these, but especially this lower one, the third, the abdominal cavity down here. Deep breathing is a huge one. It helps regulate pressure in these two cavities here, thoracic and abdominal, by expanding and compressing both kind of inversely. They have an inverse relationship to each other, the pressures in these two cavities. So we can start to see already how these strategies here, they work. Why? It's because of this foundation of pressure regulation in the body. Okay, so we've talked about what these boundaries are made of, and we started to introduce the idea that these parts of the boundaries are actually flexible and adaptable, and they help our bodies adapt to changing pressures, that changes in pressures that come from both inside and outside the body. So what I want us to do now is start to think about what are some different factors that can affect the pressures in these cavities. And let's generate a list together. What are some internal factors, so things that are happening inside the body, and what are some external factors, things that are happening outside the body. And I will start us off with one example. We talked about abdominal musculature here and how this makes up a lot of the boundary of this lowest bubble, this lowest cavity here. How many of us have worked with kids who have hypotonia? All of us, right?
Totally.
So kids who have hypotonia have low muscle tone overall, but especially, we note it in the trunk, right? Especially in the center of the body, the core of the body. And when muscle tone is low here, what happens to the pressure inside this cavity? It's lower. It's lower. So already these kids are starting out at a disadvantage. Their pressure in their abdominal cavity is lower than what is optimal for them. So they're having to work hard to try to stay regulated, just from that factor alone. So what else? What are some other factors that can affect these pressures in the bodies? Anybody